There are few businesses that haven't been hit by Omicron staff shortages, with the latest figures showing over 35,000 NHS staff have been absent in a week. That's mirrored elsewhere. At All Star Lanes' 4 locations, there have been times when up to half of their staff have been off. So Graham, how has it been? What have staff absences looked like for you?
Horrendous. It's so challenging. We were almost 1 in, 1 out at one point before Christmas. Literally, people isolating left, right and centre. It's so tough.
What would be the impact on your business if isolation days went down from 7 to 5? How much would that help you?
Absolutely. Yeah, if it's safe to do so, we'd love to see people back in sooner. It takes the pressure off those who are left behind trying to cover shifts, particularly when we hear a lot of employees have actually been at home not ill, not unwell, but of course so frustrated that they can't come back sooner. So yes, very welcome from us.
Over in the US, they recently reduced isolation to 5 days, but they start quarantining when they test positive, whereas here it's when you show symptoms. The former vaccine minister saying today a reduction, if supported by scientists, would be helpful.
What you don't want is to make a decision to bring it down to 5 days and see a spike in infections. But my very strong view is that, as the UK Health and Security Agency have said, they'll continue to review it. And of course, it'll help in terms of, for example, in education, in staff absenteeism or in other parts of the economy.
He also rejected the suggestion that free lateral flow tests would soon become a thing of the past, saying they are a big line of defence. But there are calls for the UK to learn to live with the virus. The former head of the vaccine task force says that mass vaccination should end and COVID should start to be treated like flu. While Professor Christina Pargle agrees there isn't evidence for a 4th dose, she's concerned about the signal that COVID could be moving from pandemic to endemic status.
I think the calls saying it's endemic are just way too soon. Like, we literally just had a month in December of really rapid exponential growth, which is not endemicity, right? That's an epidemic growth. And we're only 2 weeks, we're not even on the downswing yet. I don't think we're gonna get to a stage where we have, the deaths that we saw last year or the intensive care stays that we saw last year. But we are seeing businesses completely disrupted, the NHS overwhelmed, and lots of people just sick. And so I think what we have to do in living with it is plan for how to avoid that and how to tackle it.
Over 140,000 cases were recorded today. For those people, they'll be at home, out of the workforce, the impact of Omicron in place for a while yet.
Well, as Ayshah mentioned, the former chairman of the UK's vaccine task force, Dr. Clive Dix, has called for a major rethink of the COVID strategy. He believes that after the current booster vaccination campaign, future jabs should be limited to the most vulnerable and that COVID should increasingly be treated as an endemic virus.
As we've progressed to the Beta, the Delta, and now the Omicron strain, the vaccines are less and less effective at actually stopping infection, but still very, very effective at stopping people dying and getting severe disease. And that being the case, now we're in a position with the Omicron variant, which is a very mild disease in young people, that it's pointless trying to stop infection with it, which is sort of what mass vaccination is all about. Because it's not doing it. Clearly, we're seeing a lot of infection, and it's only knocking the top off it, if anything.
But just unpicking some of that, if you move to a vaccination campaign in future that treats COVID more like flu and, you vaccinate the most vulnerable people, there are still people who wouldn't make the grade for that vaccination campaign, who are younger and not in a kind of vulnerable category, who are not vaccinated now and are getting very ill in hospital. Isn't that a worry?
Well, that's a general worry, but the booster campaign doesn't address that anyway. What we should, my view now is
sorry, just to pick up on that point, it does. The booster campaign does boost people in their 30s and 40s who wouldn't qualify under your suggestion.
But I'm not saying we stop the current booster campaign. I'm saying once that's over, the most important thing now is to find the people who haven't been vaccinated at all and make sure they get vaccinated. The double vaccine probably protects against severe disease anyway, but it would be better if we boosted everybody. But after that, we've got to move to a new type of strategy.
So is it premature to even be thinking and talking about this, given that we've got, what, 146,000 daily cases, you've got over 300 fatalities a day at the moment. I know you're talking about after this booster phase, but, you know, we're pretty far from that new normality that you're suggesting, aren't we?
Well, I don't think we are. I think we're close to having boosted everybody, apart from those that are resistant, and therefore that's just a small campaign. But I think we're getting to the peak of this one, and then soon after that, we should be saying, OK, let's stop all this testing and talking about case numbers. Let's really analyse what's going on at the clinical level, and let's get ready for what we need to do next.
Stop mass testing? Stop all these lateral flow tests that everybody's doing?
Well, I think that's a little bit controversial, but you know, let's look at a couple of months' time. We shouldn't be mass testing. I think mass testing doesn't help anybody. I mean, if we know that the vulnerable people are protected, and we give them a cautious view that they shouldn't necessarily still rush into big parties and stuff. But I think we need to get to the point where if a young person gets COVID, having been vaccinated, we know that they've got levels of protection. But just like if they've got a very bad cold or they've got flu, they stay at home, and you sort of tend to anyway. And then when they feel better, they go back to work. And we should use that as the criteria, not having rules anymore. The rules were there to try and stop transmission and large case numbers. That's happened now. We're not going to stop that. It's happening.
I just want to put to you something you said last May, when you said that COVID wouldn't be circulating in the UK by last August. And you said that when all adults have been vaccinated against the virus, the UK would have probably protected the population from all the variants that are known and will be safe over the coming winter. Were you over-optimistic then, and are you over-optimistic now?
No. So two things. I was misquoted on the virus wouldn't be circulating. What I said was, if we had no new variants come to the UK, that the alpha variant wouldn't be circulating by the end of August. And actually, as it turns out, it wasn't. And I'm still of the opinion that all of our vaccines hold up on protecting people against serious illness and death without even boosting. But we can't now find that data because we've boosted everyone. But if you look in other countries where they haven't boosted yet, and particularly somewhere like South Africa, they haven't seen a huge number of deaths and severe illness, and they've only vaccinated once. Or in some cases, they haven't vaccinated at all. They've only had natural immunity, but they have vaccinated, and they aren't seeing it. So I think we've underplayed the role of cellular immunity in our vaccines because we've not measured it. But I think what's coming through in the data is these vaccines do protect people. We mustn't mix that up with stopping infection and stopping transmission, because we don't have vaccines that do that.
Dr. Clive Dix, thanks very much for joining us.
Thank you.